Good morning. Once again, we are officially recording, and I'm about to put that privacy statement in your chat box. There you go. Thanks for being here, everyone. It's quite the warm/hot day in Western Washington. I imagine it's warm wherever you are too. So grab some water if you don't already, because we're going to be hanging out together for a little bit. Please do sign in if you are using the Zoom webinar and have access to all the features. Your closed caption should be available, and if you wouldn't mind using that chat box to let us know what program you're with, your name, and if you want to participate in our icebreaker question to share with your peers, what is your favorite summer food or beverage? Today is a scorcher. So I'll let folks start signing in. Lou, you can go to the next slide. This is just a reminder, and I promise this will be the last time that I show this. We've gone through this, I think, at each of our previous webinars, as well as I tend to include it in all of your meeting reminders. But just one last time, want to make sure everyone has access to these three important links. So the Planning Grant Meeting Materials page is where you can find your curriculum, and recorded webinars and materials. And earlier this week, if you got our message, our web folks did get up all of the orientation and stuff previous to this call. So do check that out for any recordings. And of course, this will also be posted within a couple of days after. We have our additional resources page, which includes your terms and conditions. I also believe all of those contracts have gone out to your designated authorized representative. If that is not you, it is still a really healthy practice to get a copy of that contract so you have everything that is required of you and can better understand maybe what a grant writer set you up to do if you are not the person that actually wrote the grant. And finally, our AmeriCorps program handbook, which is our guide for your planning grant year. It is actually the handbook that our operational grants adhere to, but we feel like it's a good place to base our planning grant year together. I'm loving some of the answers. Lemonade sounds wonderful right now. Fresh mint is always good in anything. And yeah, if I wasn't on the clock, a brewski might be good as well. So thanks for sharing, everyone. Thanks for signing in. Lou, you can go to the next page. Our learning to date. So as we launch our actual, curriculum, the first few webinars were kind of orientation and setting the stage. But from now on, when we gather, we're going to actually move into the curriculum. And so we'll always capture our learning to date to basically remind everyone what we've done, where we're going, and what's up next. So most of you have participated in our orientation, which was kind of an overview of AmeriCorps 101. If you look at your curriculum, you'll have some links that will take you to some AmeriCorps guidance. So we like you to locate that and just kind of begin reviewing those in your quote unquote free time. And we did a fiscal orientation and introduction, both to grants management from a federal perspective, but also an in the weeds quick look at how you will bill us. How do you get your money, right? Today's agenda is the theory of change, which is the basis of any good framework for both the operational application as well as your program design. And we will also touch on evidence to support that theory of change. And then up next on September 1st, somewhat similar to the theory of change, we're going to move into a logic model, which is kind of taking that theory of change and making that a short presentable chart. And we'll talk in depth about performance measures and data collection, which are also part of that theory and program design. And after that, we start meeting monthly. So we've had a pretty big kickoff here in August, setting you up on a weekly basis. We have some one-on-one meetings with you all, I think the week of the 23rd, if I'm remembering correctly. And then, yeah, we'll start doing our monthly webinars while you do homework in between. Yeah, homework. I don't know what else to call it. I don't want people to feel like they're in school, but I guess you kind of are, depending on how you look at it. Let's see, do I have another slide, Lou? Yes, and quarterly questions. So within your curriculum, we do kind of set this up to be a quarterly informational kind of delivery system. And the questions to consider are things that you or your team or your agency might need to think through as we provide the learning and the content. And these questions usually aren't compliance based. It usually means that you have some flexibility, hence the fact that we're asking you to answer the question and we're not providing the answer. So today we're going to learn a lot about interventions, intended outcomes, design and dosages within your program, and making sure that there's an alignment between all of those things. So some of these bold questions are what Lou is going to cover over the next 2 days. So with that, I would like to introduce Lou Thompson, Serve Washington's Performance Management Analyst, who will be presenting today and our next webinar, and will be working with you kind of early on program design and providing some feedback to some of the homework pieces that you come up with. So I think this is where I fade out, Lou. Is that accurate? Are you on the next slide? There you go. Yep. All right, I'll hand it over to you, Lou. Thank you.
All right, sounds good. Thanks. Excuse me, let me just clear my throat for a second. All right, now I'm ready to go. Okay, welcome everyone. As Robin said, I'm Lou Thompson, and I am the Performance Management Analyst with Serve Washington. I use they, them, or she, her pronouns. And you'll see me pop in and out here for different presentations like the one today, and then actually the one just coming up on September 1st. And then I think I won't be back around until towards the end of the training curriculum. And so I work specifically with programs on these sort of performance management data elements of the grant, of the program design. And so if you were to receive an operating grant, you would continue to work with me on those various pieces. So I am excited to get to know each of you and a little bit more about your program. There will be parts of the homework related to the presentations that I'll have a hand in reviewing and following up with you on. So I will definitely have the opportunity to get to know your big ideas. So the webinar today is really 2 parts, and most of the materials are taken straight from AmeriCorps resources. They are so it's divided up into 2 different presentations on the AmeriCorps performance measurement core curriculum, I believe is what they're calling it. So I have both of those modules linked that you can access if you want to see the full presentation. For today, I did remove some of the slides just in the interest of time and connecting the 2 together. And also I've added just a couple, hopefully to increase engagement and participation. So those might be a little bit different. So the first one online on AmeriCorps site, it's actually module 2, even though it's our first presentation of today. So that's why it says module 2. This is the first part that we'll dig into that describes how a theory of change helps you to clarify the cause and effect relationship that's at the heart of your program. So that you will hear that term, I think, a number of times today, cause and effect relationship. And I know different funders talk about theory of change or different, when it comes to program design. I'm kind of curious if you would be willing to share in the chat, like on a scale of 1 to 10, with 1 being not at all familiar, this is a new term to me, and 10 being, oh yes, I'm very familiar. I've written theory of change narratives before. Where do you fall? Just kind of curious to have a gauge of people's familiarity with this topic. if you're willing to just drop a number in the chat that might best represent where you fall. All right, I'm seeing some numbers already. There's kind of a range, quite a range. Cool. Okay. So for some of you, this is definitely not new, and others, it's pretty new. Well, hopefully everyone will find something that is helpful for you and your program to think through. So it really is designed to give an overview, and by the end, we hope that you'll understand why it's beneficial to have a theory of change and be able to describe what your program's theory of change is, and to be able to define the 3 elements that are really key in order to construct a theory of change, and also how that theory of change is informing your program design. For the program design, also, I'll just insert here real quick that AmeriCorps updated their material. So I tried my best to use some of their more updated materials. The formatting didn't always work very well, so it's a little clunky, and I'm hoping to get that cleaned up in the future. So bear with me, and thank you for sorry, I'm just checking the chat too. All right, yeah, Robin's got some information in there if you want to take a peek, that we'll have some one-on-ones as needed. So yes, I apologize for sometimes the slides are a little funny looking. So for the program design to work as intended, there needs to be a logical connection between the need, the intervention, and the expected outcome. And we'll go through in detail each of those pieces. The theory of change is the essential backbone of your program that enables each of the pieces to fit together. So those 3 main elements, we can dig in just a little more. There's the community problem or need that your program is planning to address. And then there is a specific intervention, which is the set of activities that you've chosen to do to address the need. And that is going to be based on some degree of evidence that a similar approach has worked in the past. And there is the intended outcome. So the idea is that if you deliver the intervention according to plan, it will bring about a measurable positive change in the community in relation to your targeted need. So as you develop a theory of change for an issue that your program will address, you identify where you are now, as well as the change that you are programming for. And you are going to choose certain activities for your program, for your members, based on their link to your desired outcome. Developing a theory of change requires you to articulate some of the assumptions that maybe underlie your choice of activities. And by doing that, you'll be documenting why you think that certain activities are going to lead to the intended change. So there are some underlying elements to those main 3 elements, and those include data that documents the extent and severity of the community problem or need that you will address. So you'll be collecting some data related to that first piece. And then there's also evidence. And that evidence is what is going to inform your understanding of why a particular intervention would likely result in the change that you're wanting to see in the outcome. And we are going to cover evidence and how to find it, what it is, in more depth in the second part of this presentation. So we can walk through an example of what a theory of change looks like in everyday life. AmeriCorps has been using this example for, I think, more than 10 years. So they look to medicine to provide us with just something that's really familiar to most of us, about how a theory of change can show us the pathway from problem to solution. So that example is, if you have strep throat, then the intended outcome would be to be well again. And we know that taking antibiotics is a proven way to get there. But we also know that you can't just take any antibiotic. They're not all equally effective with strep throat. So you have to consider, what is the evidence from past studies to determine what's the best possible intervention, or which antibiotic is going to be the best one to fight strep throat. So penicillin has been proven very effective in fighting strep when taken a certain number of times a day for a certain period of time at a certain dosage. And so that makes it a pretty good choice, right? Tetracycline is also a powerful antibiotic, but it hasn't been shown to be effective for strep throat. So you take 500 milligrams of penicillin twice a day for 10 days, and you get better. So now we can look at an example for a national service program, maybe an environmental program. So in this case, the problem that the program is wanting to address is the number of wildfires that happen each year and the number of acres. So the problem is increasing wildfire frequency and destruction of public land. And we know that that's a problem because of the data that we have. So the number of wildfires per year and number of acres burned. In your planning grant application, you were asked to describe the community needs that your organization is hoping to address. And you were to provide information about just the scope, the significance, cause of the program in the community where your organization will focus its efforts using reputable, current local data. So let's go over this in more detail now. The community problem is the negative condition that exists, and the community need describes the extent or the severity of the problem in your community. For example, if a community has a number of teens overdosing on opioids, you would ask questions such as, what is the problem? What does the research say about the risks, about the impacts of this? How extensive is the problem in our community? Are we talking 2% of teens, 5% of teens? What does this mean to our community? So there's lots of questions to answer there. And the description of the problem, as well as the specific community needs, should be supported by statistics, facts, figures from current and reputable sources. So as you read about and study the problem, the goal is to gain an understanding of it that's going to help lead to your chosen intervention. Maybe you find more information about whether health classes are covering this topic. Does your community offer programs that teens could become involved in? How's the problem described and analyzed in the research literature, or even in conversations? What's been tried already to address this, whether or not it's worked, because it can be really useful to know, okay, that we tried this, it didn't work. So what else can we try? So the best data, as I've mentioned before, come from reputable sources. So we're talking primary sources. That would be things like government agencies, institutes, foundations, and universities that have conducted their own research. So news reports are not considered primary sources. And if you can get data from multiple reputable sources, that can really increase the reliability of the data, or your ability to trust that it is accurate. And up to date or current. There's really no hard and fast rule about what counts as up to date. I have seen AmeriCorps use within the last 6 years for research. So I think that's a good ruler, but that's not always going to be the case. But as current as possible, basically, is what you're looking for. And the data that you find should be as locally relevant to your program as possible. So if you're serving one county, then the data we would suggest that you look for data specific to that county, or maybe it's a specific school district that you're wanting to serve, or maybe it's a whole bioregion if you're an environmental program. So you would find data that's specific to that locale. National level or state level statistics generally don't tell you a whole lot about the problem as it's affecting your community where your intervention is going to be implemented, unless you're operating across the state. Then some state data could be helpful, but generally you're still across the state, you're choosing very specific sites that you want to target. And so we want to know, why are you targeting those sites? What's going on there that makes you want to place your members there? So it needs to be clear why you selected particular communities for your intervention. So here are just some examples of data sources that you might use. We've got census data. There's data from OSPI if you're an education agency, or that's your focus area. There are lots of other sources. And if you have a really cool source that you love to find data for your program, feel free to share that in the chat too as a resource for others. If it's not listed on here that is kind of your go-to, feel free to share. You never know who it might help.
Lou, can we also pause and talk a little bit more about reputable data when it's located within your own organization? So for example, Girl Scouts and some other organizations will actually have research departments and they have their own data. Can you speak to the benefits of your own data and whether or not you need to go outside of your own data?
Yeah, that's a great question. Thanks for pointing that out in the chat. I think that's great to use. If you have it, use it, especially if it's something that's really specific that is beneficial for your program to know, but maybe it's not really collected anywhere else. If it is, I think it could be helpful to include that also and say that this finding is also backed by X data source. So if it does come from multiple areas, that could be, I would encourage you to cite both. But totally understand that sometimes if Girl Scouts, for example, has like something really specific that you're looking for and nobody else is collecting that data on the scale or to the level of detail that you are, then certainly include that, and you could include a little more information about how that data was collected, just to further demonstrate the confidence that it is reliable, that it is trustworthy, like that the data has been cited and used by other organizations that that people generally trust and defer to. So I don't think you would necessarily need a second source to be competitive, but if it exists, then use it. I hope that answers the question. Great. Yeah, and I meant to say this at the beginning, but certainly feel free to jump in with any questions or pop them in the chat. Thanks to Robin and Jenny, they can help monitor the chat if I miss something while I'm talking. But I'm happy to pause at any point and chat through anything. All right. So to continue our talk about data that describes the community problem or need, ideally it would address three broad areas. So the scope, which is the extent of the issue in your local community. So that data would answer the types of questions like, is this an issue specific to a target group of individuals based on race, ethnicity, sexual orientation, gender, age, or protected class of individuals? What's the severity or intensity of the need for those affected? For example, how many individuals or families are directly affected, either in absolute terms or a percentage of the entire community? And then there's the significance. This is the so what question. Why should we care about this particular need? This would include sharing data that tells us how the need affects the community more generally and how this is connected to other community issues. Sharing data on trends or the likelihood that the need will worsen also speaks to significance. And if you can share data about that, that really is what can make your problem read as like just very compelling. If you can answer that so what question, why do we need to care about this? Why does this matter? Why is this important? And then finally, the cause. Why does the need exist? How did it start? What are its roots? You might even have some historical data that you could share showing how it started, how long it's been around. The data on the scope and relevance pertain to describing the community need, and data on the causes of a problem will also inform your choice of intervention or the service activities that you choose to address the problem. And I will give a word of caution here about really lengthy problem statements that outline every possible negative condition in a service area, even if it's maybe not directly relevant to your proposed intervention and outcome. When you're looking for data, you're going to come across all kinds of stuff, and it could be really fascinating, really intriguing, but it is probably not all directly related to your program and what your program is wanting to address. So just a word of caution there about including, we call it a data dump. Don't do a data dump and just include every piece of information that you can possibly find. Really be mindful and think about, is this really relevant to what we want to address? And only include data that is directly relevant. Let's see. Okay, so here's just kind of a quick exercise of a possible data dump. So in this example, we have a program called AmeriCorps, and they maintain trails throughout public parks in Iberia County. Many parks have deteriorating trails. They have a lack of maintained trail systems, which leads to soil erosion and water runoff that pollutes nearby streams. Hikers are more likely to not stay on the trail because they're not well maintained, and they end up damaging the fragile habitats along the trails. So if this were your program and you were choosing what data you wanted to include with your problem statement to support the issues and document those issues, do you see any data in the list that might be less directly relevant to include? Would it be water pollution concentrations, measures of soil erosion, poverty rates, invasive species cover rates, miles of unmaintained trail, or the average number of hikers? What to you all seems like, maybe that doesn't need to be included? It's not directly related. See someone in the chat put probably poverty rates. I would agree. There was nothing in the problem statement there that described poverty being a concern or somehow related. Great. Someone also said invasive species. I would agree with that. That wasn't mentioned, so there would be no reason to include that data unless you made a clear case as to why you did include it. Great. Well done, y'all. Thanks. And here I encourage all of you, as you're creating your theory of change, to really think through how we're describing the community problems that exist and the data that we're using to document it. And so I'm going to share just some of what I've been thinking about and learning as part of my equity journey, and have come to the realization that some really common terms that we use in public sector, the nonprofit sector, might need an update. And this isn't something that your application is scored on. This is simply because we at Serve Washington want to be more mindful of systems of oppression and how we describe the work that we do. So you'll see there are some common terms listed on the slide: at-risk youth, underserved community, achievement gap, under-resourced. Those are just some examples, and language is always evolving and changing. There is a link at the bottom for a full article where I got some of this information, but this article points out that when we use the term at-risk youth, sometimes that really is positioning certain individuals or communities as centers of risk. But if we examine it a little deeper, we see that the risks are actually coming from things like criminalization, policing, or disenfranchisement from economic freedom and things like that. Underserved community, it can be a phrase that positions us as saviors coming in to provide charity as the solution. And the idea being that if we just give more services, then everything will be okay. But we don't want to ignore systemic oppression that might be present. And the achievement gap. This article challenges us to consider, what if there is no achievement gap? What if there is just a very predictable disparity in learning outcomes between well-resourced community and those who are poorly resourced? Calling it an achievement gap takes the attention away from the reality of generational wealth and access that are afforded to some students, but not others. And under-resourced also could be a way of describing the historical exploitation of Black, Indigenous, and people of color communities as happenstance rather than as coordinated campaigns of disenfranchisement and marginalization. And it also positions the current distribution of resources and access as something that could be fixed with a simple realignment of policy in an otherwise well-intentioned system. So we aren't suggesting to use exclusively positive language, which can sometimes have similar kinds of problems with feeding into a bootstrap sort of narrative. Like if everything's so great, then what's the problem? And we do want to avoid the problem of having the struggles of individual people or places represent something inherent to them, but really explicitly point out the systems that are at work, either past or present, that are causing these inequities. So if you're talking about a problem, we would encourage you to use language that reflects that systematic disparities and community-wide problems, in fact, have systemic causes, that harm has been done at some point, and that these are not self-caused problems. And as much as you're able to, and as much as it's relevant to your program, we invite you to explicitly to describe those systems whenever possible. So as I said, language does change really often. Some of the information that I included here could already be considered outdated. You might know of other terms that are better to use. But I will share that the equity language guide on the governor's interagency council on health disparities has shared this report with some suggestions for terms to avoid. So this is just a resource if helpful to you. Again, it's not something that your application would be rated on, or that we're scoring, but could be helpful as you're thinking through the community problem and need. Specifically, to me, it is very related to the theory of change in general, but also when we look at that question about cause. So when we're trying to describe the cause of the community problem that we want to address, this could be a really great opportunity to really think about those bigger systemic issues at play. So again, from the governor's interagency council on health, they included this statement about state data and how state data have consistently pointed to differences in access and outcomes experienced by people of color. Examples include gaps in kindergarten readiness, disproportionality in the criminal justice system, disproportionate exposure to environmental hazards, health inequities. And when documenting these inequities, state agencies have historically used language that explicitly stated or implied that race or ethnicity was the risk factor. And now the council is guiding agencies to be more explicit about racism and other forms of oppression as the underlying cause for the inequities that exist and that are showing up in government data. Such inequities may be due to overt interpersonal racism or institutional racism. And so when sharing information on outcomes by race or ethnicity, the encouragement is to include context about the underlying reasons and why it's relevant to your program. Again, we don't want this to become a data dump. And so if there is a lack of opportunity, our policies exist that have a disparate impact on people of color, then we would ask you to name that, call that out. All right. Thanks for hearing me out on that piece.
Hey, Lou, can I give another example and you can grab some water or take a breath?
Yeah, great.
Something that I recently learned, and it just really opened my eyes, and I don't have the visual for you visual learners, but if you can think about how frequently schools or school districts report data on student behavior. And often they do so based on demographics as well, and separate that out by potentially like race or other identities. And when you look at that information as someone who's socialized to look at that information, it automatically blames the student. So you have X number of students suspended, or X number of student missing school days, or and if we took the idea of what is the accountability of the school, and the school reported it by the school's choice to suspend X number of students, or something of that nature, and kind of flip-flop, so that the school and the school district can begin to identify, is there bias in how they are treating student behavior? Is there a bias in the number of students that they're suspending in a certain demographic? And so I wish I had a visual, but it was just really eye-opening to me how often when we report any type of statistic on individuals, whether it be in health or schools or students or folks living in poverty, we refer to them as the data point, which often centers them in the blame, instead of centering the system that is choosing to actually report out on those, or choosing to address those issues. So just, I don't know if that resonates with folks, but it resonated with me, and I wanted to share that. Thank you, Lou.
Yeah, thanks for that real life current example. Definitely. So we've been talking all about the community problem, need, and the data that documents it. Now we are going to move to the intended outcome. So after you have clearly identified the problem that your program is addressing, the next step is to consider, what's your desired result? So let's just jump straight into an example of possible intended outcomes. So we have a theoretical economic opportunity program, and there's several possible intended outcomes to measure. And we will discuss outcomes more in the upcoming module, so I won't go into a ton of detail right now. But here are just some examples for an economic opportunity program. You might want to look at whether participants secure employment, whether they transitioned into safe, healthy, affordable housing, or whether they improved their job readiness. It kind of all depends. But we're ultimately looking for some clear alignment with the problem or need that you identified. And depending on what that intended outcome is, that will inform your intervention. But first, another word of caution about outcomes that can be really difficult to measure, or maybe don't quite align with the other components of your theory of change. So we're really looking for outcomes that are measurable during your grant, specifically during each program year. So once you know what change you intend to make, the outcome, right, then you can determine the most effective way to intervene. So in your planning grant application, I believe you were asked to describe what activities you see AmeriCorps members engaging in and how those interventions might lead to positive outcomes. So this will be your opportunity to revisit that and really look at that in more depth. An intervention is a specific set of activities in which your participants and volunteers will be engaged. It's the strategy you employ to bring about the change for those who will benefit from the services. So again, you're approaching this step with at this point, you should have an understanding of the scope, the significance, and the cause of the problem or need that you're addressing, and an identified outcome or desired result. To determine what could be an effective intervention, you'll look for evidence. Evidence can come from performance measurement of your program, or maybe similar programs. It could come from evaluations, again, of your program or similar ones, research studies that show that the intervention that you're proposing is likely going to help you achieve your intended outcome. You'll look at what interventions others have tried and whether they've been successful or not. Again, it's super helpful to know what hasn't worked so you can learn from that. So here's an example of how evidence is useful when designing your intervention or modifying an existing intervention to make it more effective. Maybe you've got evidence from an evaluation, and that evaluation shows that some specific number of hours of physical activity for teens led to improved physical condition. Then you might consider having an intervention be a similar number of hours of physical activity if you're seeking to improve physical condition for teens in your program. So it's important to note that there are certain things like physical activity that can be a very broad thing, a very broad type of intervention, in the same way that antibiotics like penicillin, right? Well, there's different types of antibiotics. They're not all created equal. So as you're reviewing evidence for what's worked, you do need to pay attention to both the design of the intervention, so who's doing what with whom, and the dosage. So the particular like amount of service that's being provided, to better understand what worked, what didn't work. As part of the theory of change, you need to describe your intervention with this sort of detail. So you need to just identify the design. It should be very clear who's doing what with whom, and typically who is your AmeriCorps member. So your AmeriCorps members, or maybe the volunteers that they recruit, or what are they doing and who are they doing it with? Describe that population that you're serving with some detail. And then the dosage. And by dosage, we're talking about three things: frequency, intensity, and duration. So in the dosage, we're looking to know how often, like how many times a week, for how long, and how many total weeks or maybe months of sessions or services, activities. So in your intervention, you will need to define all of these details. And here is an example from the after-school community-based run-up program. The design in this case is that the National Service participants use the run-up curriculum to serve small groups of 3 to 5 of youth ages 17 to 21 to increase physical fitness. I'm seeing I've got 30 minutes per session, and then in the intensity, it's got 60 minutes per session. So I need to make myself a note to update that. And they're educating them on body awareness, and the frequency is twice a week. Intensity, we're going to go with 60 minutes per session, and the duration of the program is 12 weeks. So that's just an example of the type of detail that we're looking for. And again, with our caution statement after each of these components, here we've got a word of caution about interventions that are defined in really general terms, but don't have that sort of detail, or maybe don't have support of evidence. So here's an exercise. I would love if people could have a look, and you can, again, reply in the chat or over the phone if you're comfortable. Here is a sample intervention. It is saying that there's a program that's going to do tutoring, structured physical activities, field trips. They're going to be 3 to 4 hours daily throughout the school year. So in looking at this, does it tell us what we need to know about the design? So that's who does what with whom. And then is it telling us everything we need to know about the dosage? So that's the frequency, intensity, and duration. What do you think? What are you seeing? Who does what with whom? Is it sharing that? Do we have the detail we need about the dosage, which is the frequency, intensity, and duration? The chat box is really quiet right now. I think we're going to have a break coming up. I hope everyone's can bear with us for a bit. I will go ahead and show the next slide, which shows us the level of detail that we're really looking for. So here's a different example that shows us more clearly what the design could look like. So we know who does what with whom. And we're talking 30 AmeriCorps members, and they are working with teacher identified 3rd through 6th graders. And then we've got the dosage, and that is telling us all the detail we need about the frequency, the intensity, and the duration. So that's just an example, again, to help you know, this is sort of the format that we're looking for. This is the level of detail that we hope to see.
Hey, Lou, since the chat box is kind of quiet, could you just point out the 3? Maybe you and I can tag team, because I do find people get confused between intensity, duration, and frequency. So
Okay.
intensity in this example, what would you point out as the intensity?
The intensity, and again, did I have that defined on the? Yeah, so frequency is how many sessions. Intensity is how long is each session, and the duration is how many total weeks of session. So we can pop back over. So at least 2 hours per week. I would say that's the frequency and intensity, because it's 2 hours and it's weekly. So 2 hours would be the intensity. Frequency is weekly. And then it's going on throughout the school year.
Duration. Yeah.
Every day throughout the school year would be the duration, right?
Yeah, thank you for that, because I think sometimes folks are looking for numbers, like they need 3 different numbers, and oftentimes it can be described in a narrative such as school year would be duration. So I think that's helpful to point that out, especially since folks were quiet in chat. Thank you, Lou.
Yeah. Yeah. Although this, sorry, as I'm reading it, this one's a little more complicated because they're doing 2 things. They're doing tutoring and some physical activity. So there's some physical activity, 1 to 2 hours, which is the intensity each day, frequency, and then the 1-to-1 tutoring is happening 2 hours per week. So there's 2 different activities. So that does get a little more complicated if you have multiple activities that you're doing, to make sure that each is clearly defined. Great. All right. So again, I think we've got just another couple slides and then we will take a break. After you've laid out all three elements of your theory of change, you'll be asking yourself, is it plausible? Does the logic make sense? If we do these things, are we likely to get the results we expect? And then you'll ask, is it feasible? Do you have enough resources to implement the intervention you've chosen? You've got to find that sort of sweet spot. What can your program accomplish in a year? And then, is it meaningful? Are your intended outcomes important? Is the change that you're expecting to see, is it worth the effort? These are all important questions to ask yourself to test out your theory of change. So to summarize what we've covered, we have been talking all about how a well thought out theory of change will help you identify the pathway that links your service activities with your intended outcome. And you've got three elements to focus on: the community problem, the intervention, and the intended outcome. And those underlying elements of data and evidence that are supporting them. The data documents the community need and should show scope, significance, and causes. And consider how you might apply an equity lens in communicating these aspects. And we certainly commend those of you who have been doing this already. I'm sure a number of you already have. And we are all learning. So that is it for theory of change. We will be talking in more depth about evidence, but we're going to take a 10-minute break. So I see it's 11:04. Robin, do you want to call it 11:15? We can do 11 minutes.
Yeah, absolutely. And I'm going to pause the
Okay.
recording so that you can show
Okay.
your video without any privacy issues or
Okay.
whatever
Perfect.
that YouTube issue is. So
Thank you. Okay.
pausing now.
And
we are recording once again, Lou.
okay. Wow. All right. Well, I hope everyone is back. I think we are ready for our second part. Again, it says modules 3 there because of the way AmeriCorps has it organized on their website. It's the third module in their series, but it is our second part today. And it's all about building evidence of effectiveness. In this module, we'll be talking about how we can use evidence to help select an effective intervention. So the goal is to learn how evidence supports your program's theory of change, including your program design. We'll learn about different types of evidence and review some considerations for assessing evidence from your own program or similar programs. This is really an introduction that focuses on developing a basic understanding of evidence and what it's all about. All right. So just a super quick recap. We've got the different component elements of the theory of change on the screen. We know that evidence it relates to our theory of change and is important to understand the problem, why it exists, as well as how prevalent and severe it is. But it's also equally important to choose the best intervention to address that problem. And your choice of intervention, we hope, will be informed by the best available evidence about what approaches are and are not effective in addressing that problem and leading to the changes that are outcomes that you intend related to beneficiaries' knowledge, attitudes, behaviors, or even maybe the condition. Programs sometimes confuse the use of data to document the need and the use of evidence to support the choice of intervention. Both are important, but we're really focusing now on the evidence piece. So the part that is helping you decide what intervention to use and the design and dosage of that intervention. So in the context of our work here, evidence is referring to the information or the facts that are systematically obtained in a manner that's replicable, observable, credible, verifiable, that you can use when making judgments and decisions about your program. So it should be the result of some strong data collection and research on your part. If you're starting a totally new program, evidence should provide a really sound basis for you to help guide you in choosing an intervention that's going to meet the specific community need you've identified. And once you know the community problem that you're addressing and what change you intend to make, then evidence helps you determine the best intervention to make it happen. And if you're already operating a program, evidence will help you understand whether your intervention is producing the outcomes that you intend to. Evidence shapes program design in different ways at different stages of programs development. So again, it might look a little different for new programs versus existing programs. And I am, again, still learning about each of you, so I'm not sure. I would imagine we have kind of a sprinkling across these different categories. So with many program designs, AmeriCorps considers the most rigorous type of evidence to come from evaluations that had a comparison group or some sort of control group. And these types of evaluation designs are known as quasi-experimental or experimental designs. So just like in medicine, comparing outcomes for both individuals that do not receive the intervention with those that do can really help researchers establish whether there is a cause and effect relationship between the intervention and outcome. So as we've already discussed, the theory of change is a theory about that cause and effect relationship between the intervention and the outcome. And these kind of rigorous evaluation designs are specifically designed to test that theory. And when we use experimental, quasi-experimental evaluations, when they have established that there is a cause and effect relationship between the intervention and the outcome, the program is then said to be evidence-based. But we also want to note that this evaluation design is not appropriate for every program type. It's really meant for programs of a certain size with a certain degree of standardization across sites. And it can be a very costly type of evaluation as well. It's not required of programs who receive less than $500,000 in the AmeriCorps share each year. So we will talk about evaluation and evaluation requirements down the road. Don't have to worry about that now, but just a little FYI to add some context. But there is a continuum from evidence-informed to evidence-based. And as we've already begun to note, new programs will start by developing a theory of change that's grounded in evidence about what has and hasn't worked for other programs. And over time, our hope is that programs will build an evidence base of their own program, starting with performance measurement, which again, I think that that presentation on performance measurement is coming soon, so hold tight. And then eventually through some outcome evaluation and maybe through more rigorous evaluation designs that can demonstrate that cause and effect relationship. Here is a visual that AmeriCorps has been using for many, many years that kind of shows the continuum from evidence-informed to evidence-based. New models start at that first step, developing their theory of change and really honing that program design piece. And then we'll move through. But also note that even though there's a clear directional arrow there going from left to right, the process really isn't always linear. You could have findings at any stage of the process, and that could result in some program design changes that might push you to return to some earlier steps in the continuum. That's totally normal. Maybe after some years, you see your program's not meeting your performance measurement outcomes as described in step 3, and maybe you need to go back to the drawing board and look at evidence of other interventions to see, like, what else should we try? What's going on? And evidence at all stages of the continuum is really valuable. Positive findings at any stage help to build your program's evidence base. And as I keep saying, I think this is the 3rd time I've said it, negative findings or findings, things that show you what's not working is really, really valuable too. When you see that something has no effect, then you can use that information to change and improve your program. And we and AmeriCorps fund programs at all stages of the continuum. There's no requirement that you be at a certain stage. Programs kind of fall all over. So let's now talk a little bit about how to find and evaluate evidence to support your theory of change. Really common sources of evidence are evaluations that document the outcomes of similar programs. As noted earlier, programs that rely on evidence from similar programs will fall toward the beginning of the continuum, that evidence-based, evidence-informed. You might also use performance measurement outcome data from your program or a similar program, and results from other types of evaluations. Again, there are just so many different evaluation designs. Some are considered more rigorous than others, or more able to demonstrate that cause and effect relationship. So let's look at some of these sources in more detail. So the first source of evidence, it would be evaluation results from other programs. And so if you're looking at that and considering that type of evidence, you'll need to assess how applicable is that evidence to the design of your program. If there are other programs that have successfully done what you want to do, maybe you want to replicate all or part of these models into your own model. And we're going to cover a bit about where you can search for that sort of information to find out, is there another program that's doing what you're doing? If you have your own past performance measurement data on outcomes, that's fantastic. These past outcome findings, while they don't demonstrate causation, they do provide data about whether or not a change occurred, and that can be super helpful. It shows that the intended result was achieved. So if you're looking at your past performance data as evidence for an intervention, consider, what do your data tell you? Did you achieve your intended outcome? Do you have multiple years of outcome data you can even roll up and aggregate? If you do, then using data from multiple years could really make a stronger case for the effectiveness of your intervention. And if you have it, definitely use it. Another source of evidence can be the results of an evaluation of your program outcomes. This could be an evaluation maybe that looks at a change in beneficiaries over time, or maybe you have a comparison group that looks at whether there was a causal link between the program activities and outcomes. So if you're reporting on that, really kind of determine what type of evaluation is this. Did your evaluation look at outcomes, or maybe it was the process evaluation that looked at how your program was implemented, but doesn't really look at outcomes or causation or provide evidence about the effectiveness of your intervention. That's totally okay. We like process evaluations as well, but you wouldn't use it as evidence to support your intervention. Does the evaluation that you have document changes in beneficiaries' knowledge, attitude, behavior, or condition? And if your program didn't meet the outcomes as expected, what did you learn? What changes are you making to improve? Does the evaluation show that your intervention is what caused the change? Not all outcome evaluations will be able to demonstrate causation. Again, that's okay. Use what you have. Just be clear on what it is and what it's showing you and what you can learn from it. So there are several factors to consider if you are assessing evidence from your own or from other programs. You need to be sure that the intervention that was studied is similar to your program intervention if you are looking at other programs. So you'll want to know if the intervention, how similar is it to your intervention in terms of design, the dosage, the types of beneficiaries served, the outcome that's being achieved. If there are a lot of really big differences, and that can be hard to assess, we can certainly, I can chat with you one-on-one if you've found a evaluation or example of another program and it's hard to tell if it's really similar to yours or not. We can certainly talk through that. But if it's really different, then you might not want to use it as evidence for your theory of change. In order to use another program's evaluation, we really want their program to be pretty similar to what you're proposing, because evidence that's not similar would have a different population, or maybe their intervention isn't really comparable to yours. Other considerations for evidence from your own or a similar program include, is the evidence significant? Did the findings from the study or maybe studies, did they show with confidence that the program model that was being studied had some positive and significant effect on target beneficiaries or entities? And by significant, we mean, were the results statistically significant? So that's like the key term you'll search for. Was it statistically significant? And then, is the evidence up to date? How recently was it published? Again, the general rule that AmeriCorps uses is 6 years, though that's not a hard and fast rule, but just generally studies older than 6 years might be just fine. If you can, with some confidence, know that the conditions that the program operated in when the study took place are really the same or similar to the conditions that exist presently. You'll also look at the evidence, whether it had high methodological quality. Do the studies use well-implemented and appropriate research methods given the research question of interest, using high-quality data? Again, if some of this you're unsure about, these are things we could certainly talk through, because it can be hard to determine the quality of a study if this is all very new to you. And then finally, again, we talked about being reputable earlier when we were talking about data. So the same applies to evidence. Is it coming from a reputable source who doesn't have a stake in the outcome? It could be really helpful if it was published in a peer-reviewed journal, or is just coming from a well-known, credible organization. So earlier we looked at the evidence continuum as a series of steps. There are 5 steps. This slide is a little bit different. It's showing another way of classifying the various stages along the continuum. And this is the AmeriCorps developed this, and they have sort of these tiers that they are using to categorize evidence. So programs who are at the moderate and high ends of the continuum have conducted more rigorous research designs that are designed to determine whether a cause and effect relationship exists between the intervention and outcomes. And then there are performance measurement and outcome evaluation that look at whether a program achieved its intended outcome over time, often using a pre and post test. Performance measurement and outcome evaluation results can only show that a change occurred, and they're not necessarily proving that it was the intervention that caused the change. So these sorts of outcome results are considered to be preliminary or even pre-preliminary. I think I have a note here that Robin will be sharing additional detail on the evidence tiers, and because those evolve a little bit with each NOFO. And so we don't want to confuse those evidence tiers that are listed in the NOFO with the just general evidence continuum. Evidence impact evaluations use rigorous data collection methodologies that go beyond just documenting that a change occurred to determine whether the intervention caused the change. And they're designed to collect data from people that received the intervention as well as from similar people that did not. So then that allows researchers or evaluators to compare between the two groups. In some cases, they might even be able to randomly assign people to one of the two groups, and those that receive the intervention and those that don't. And that's what's called an experimental design. And it's usually the most complex, the most expensive, and it's a more rigorous way to produce some high quality data.
Hey, Lou, just to provide a little bit of clarity for folks, since we did have a range of folks with this language and knowledge, and for folks that are really just starting to figure this out, I think it's important to note that when you're developing your theory of change and you're building your program design, most often than not, you're going to start with preliminary evidence, and that's okay. We don't necessarily know or expect brand new applicants to be able to find evidence or have proven evaluations that allow you to be in a moderate or strong category. And so when you hear us talk about building evidence and evaluations, that's part of a long-term research strategy once you've been awarded for multiple years in an AmeriCorps program. And so right now, for those of you just building your theory of change, it's really about looking and collecting some evidence that may support that initial stage, that pre-preliminary, that initial stage of building evidence. So I just know this is really overwhelming sometimes for folks, especially folks that are brand new. And I don't want anyone to assume that during the planning grant, you're going to be performing any evaluations or that you're going to be doing anything directly to gain a tier or a level. You're just collecting, you're just starting to put a framework together. And we'll talk more individually, but I just know that there's folks that are brand new to this. So want to ease any fears out there.
Great, thank you so much. Absolutely. Yeah, so I am pretty much wrapping up. I think that I just have one more kind of wrap up slide after this one. So I don't know, Robin, I know you have kind of final thoughts and wrap up to do also, but if there's time, I could pull up the like AmeriCorps evidence exchange, for example, if that would be helpful for people to see kind of how that works. And just one of the ways that you could search for programs that maybe you're doing something similar to what your program is doing, and see who else is out there, and do they have some evaluation reports? Would that be?
Yeah, go ahead. If you want to spend a couple
Navigate.
minutes on that, that's fine.
Okay. Are people seeing that screen, the evidence exchange screen? Or are you still seeing the slides?
Nope, we see it.
Okay, cool. So
it's tiny, but we see it.
Oh, okay. I wonder if I could do some zooming.
That's better, thank you.
Okay. So this evidence exchange is one that AmeriCorps, the federal agency, created specifically for AmeriCorps programs. So it's not, an exhaustive database of like just every possible program, but specifically of AmeriCorps programs that have completed an evaluation. And so you can search their exchange. There's different filters. Generally, we would suggest searching for AmeriCorps state and national, but you don't have to. There could be other reports in here of similar programs that aren't AmeriCorps state and national. Maybe you want to look for a particular type of study. It's up to you. Could search for the date it was posted. And there's, someone recently drew my attention to this metadata glossary. So I had been searching just for different things that I thought might be helpful, and I was getting just no results. And then I realized that there's this metadata glossary for keywords. So each study has different tags, and it's really helpful to have a look at how AmeriCorps has it organized. So what are the tags to search for? So just kind of gonna go down. You could search for different focus area, but even if you want to be a little more specific, there are more categories. So maybe you're in the education arena, but want to look specifically for school readiness. So more like pre-K. So that would be that's kind of a designated tag that they use. So any one of these, you could search more specifically for these categories and put that in the search box here. And that should help pull up more specific examples. So again, we don't need to go into it anymore, but I just thought that tip would be really helpful because it helped me recently. It's not super clear.
Can we do one? Will you do like access to care?
Sure.
Which was under the health.
Okay.
Yeah, I thought we might get a lot of COVID programs. That's cool.
Birth and Beyond program. Let's see how many total we get. We get 2 pages.
That is a helpful tip. So Lou, since you're just learning about our programs, I'm going to be really broad, and I'm probably going to offend some people on the line. But so I think we have a program focusing on health. We have a program potentially focused on disasters, response to disasters, and we have a program potentially focused on mentoring and wraparound services for youth. So no, no strong evident or no strong education programs, interestingly
Okay.
enough, which is
Yeah.
always the example we use. So I wanted to use a
Yeah.
non-education example.
Great. Totally. Yeah, that's exciting to hear those different focus areas. All right. Well, and again, I'm here. If you have a hard time navigating this, or again, there's some other resources listed on this on the slide. Oh gosh, well, it brought me back to the beginning. There are some other resources on the slide. Google Scholar is a good one. I realize I didn't update this. This is still the old branding on this slide. I can update this, but just some other search engines. If you have other ideas, resources, feel free to share that with your peers or with me. And if you need help searching or just having a tough time, let me know. That's something I could help with. So just to wrap up this evidence section, evidence enables us to determine whether or not a program is achieving or is likely to achieve their intended outcomes. The theory of change should be informed by evidence, the best available that you can find about what intervention is or isn't likely to be successful in meeting those outcomes. There's a lot of different types of evidence. Each has a different value, different limitations, and there are just a lot of factors to consider when assessing evidence. And I linked to the performance measurement core curriculum where you will find this and related presentations. And I think that is it for me. I can turn it over to Robin. And if at any point you want me to pull up the homework form, let me know.
Thank you so much, Lou. Applause to Lou. Thanks for being here. We'll get to spend some more time with Lou next time, and we will be sure to have Lou in some of your one-on-ones, as well as reviewing some of your homework and giving feedback. So thank you all for your engagement today. Lots of information. I want folks to know that if this is feeling really, really new, I promise we are here to support you. We have an entire year together to figure this out, and it is a lot of information up front. Our curriculum is actually built purposefully to give you the most content up front. The first few webinars are going to be pretty heavy like this. And then mid-year, you're going to start to see less content, shorter webinars, less things you need to learn. And we will actually close out the year introducing just very brief concepts and information that's more longer term in nature should you actually run and operationalize your plan. So I want to introduce you to this homework concept. You will see this listed in your curriculum. The homework pieces in your curriculum are the pieces that you're going to spend a substantial time on with you and your team doing design work. And you're actually not going to submit everything that you do. There's always more homework that you're accountable for to become successful, but you will also submit some deliverables here and there. So right now your homework list is pretty short. This is going to grow, but we want you to continue reading your curriculum, getting familiar with it, reviewing and reading those AmeriCorps guidance documents that we introduced in your orientations. And now you're actually going to start beginning to develop a theory of change and identifying evidence that may support your theory of change. And I say may because not every program is going to have solid evidence. Some programs are going to really start from scratch, and that's okay. We do have a template for you to help launch your conversations and brainstorms around theory of change. Lou, if you want to take just a moment to pull that up, We will be sending this out. It will also be posted on your planning grant webpage. Now, if you historically are really familiar with theory of change and you already have one and you're, making it fit AmeriCorps, you don't have to use our template. I would highly, highly suggest you use our template, but you may ultimately want to provide us with some kind of different documentation. But you can really see that it is as Lou is scrolling, it is walking you through a lot of the main points from the presentation. And then it will ask you to do a couple of exercises, and it will help you to gather those thoughts, to organize those thoughts, and to come somewhat prepared to us with just a general framework. And when you do your homework and eventually when you start submitting deliverables, we will provide you feedback. So this is a partnership. We are here to support you throughout the process. We do want you to try a little bit on your own up front. And then we are here to kind of narrow in and tell you what we're seeing and ask some more good questions for you to consider. So we'll send this out and you can start working on this in the coming weeks. If you want to go back to the slide, Lou. So your deliverables right now, again, a short list, it's going to grow. Theory of change, that sheet we just showed you, eventually you're going to turn that in. And so around mid-October, you're going to have a series of your first quarter deliverables, and you're going to be submitting those to both Lou and Jenny, who is your assigned program officer as I depart my role here. But those will be submitted and you will get feedback. You will get one-on-one meetings. You will get detailed comments. We will provide you with what we feel is putting you in the best possible successful place with your ideas and your framework. So I see a question in the chat box. Lou, I wonder if you could navigate for me. Do you by chance have the Serve Washington website at your fingertips? Thank you. And if you go to programs on the top there, and you go down to subgrantee resources, and you go down to planning grant meeting materials. Yeah, that first blue right at the top there, planning grant curriculum. Looks like someone has a question about that. So I just want to show this once again. It's a PDF. Lou, make that bigger and then scroll to page 2. All of these checkboxes are essentially the steps that we are walking you through and the homework that you're being assigned. So right now in August, you've had a series of webinars and you're going to begin developing a theory of change and identifying evidence by using our template. And if you scroll down, Lou, so your Q1 deliverables, eventually you are going to turn in that theory of change. You can stop right there, Lou. That theory of change framework, and we're going to talk about logic models and performance measures, and you're going to have templates for all of these deliverables that you're eventually going to submit. So hopefully that helps a little bit. We like to give you choice and freedom on when this occurs. So we don't necessarily pin you down to how many hours per week or anything like that. But the homework essentially is every box, every step, and the deliverables are outlined by quarter. Okay, good. I'm glad that's helpful. So at this time, we are right at 8 till the hour. Like I said, the first couple of webinars do take the full time, and you'll start to see some of that time decrease. So I'm gonna actually close the webinar recording, and then we'll move into more of an informal Q&A. Thank you everyone again for your time and attention and engagement today. This will be posted shortly.